Hello, my name is Dr. Thomas Lamperti. I'm a double board certified facial plastic surgeon in the Seattle area. I'd like to talk today a little bit about the role of facial volume loss with regard to the aging process. Often patients who come to me looking to improve their appearance and look more refreshed and rejuvenate their appearance have specific concerns regarding maybe their eyelids, their lower eyelids, their brows, cheek, jowl area, etc. And often these problem areas or problems of concern can be addressed at least partially with volume enhancement. The ways to enhance the volume are several-fold. There are injectable products that can be done in the office. Restylane, Radiesse, Juvederm, Perlane, those are products that can be just done in the office. And those enhance the volume. They last 6 months to a year, roughly, given the actual product used and where it's placed. It'll last longer in some places than others. Another possibility is performing facial fat grafting or facial fat transfer or lipostructure. Those are all different names for the same process, which involves harvesting fat from yourself, from the abdomen or thighs generally, processing it in a centrifuge to isolate the fat cells, and then injecting them very carefully, three-dimensional lattice work really, to affect the volume enhancement that we're looking for. This is done with more anesthesia generally than is done in just an office, but again, very minimal types of incisions or access that allow for a very great gain in results. The grafts get a new blood supply, and this takes several months, but then affect for a longer lasting volume improvement. Often when I have patients look at photos of themselves when they were in their 20s compared to currently, we'll often find that it's not so much that there's been a sagging or drooping of whatever feature it is that they're worried about. It's more that there's been there's less volume there to affect the lift, so to speak. It's very evident, especially in the lateral brow area, where the brow might come down a little bit as we lose some of that natural fat around the eye. Certainly with the cheek, it's a very common area where it'll sag down a little bit, and maybe it'll make our nasolabial fold more prominent as that tissue will press up against that natural skin crease. So really by improving the volume, allowing that skin to come out and project more rather than come down, really affects that change very well.